Philips is really spending a lot of time thinking about how we can connect the dots between all the cool stuff that's happening in the connected home and wearable space on the consumer side and what's happening in the traditional healthcare worlds, where health systems are looking for ways to go outside of just hospitals and really extend care to everywhere that consumers are. In healthcare, it's even more critical because if you think about our desire to create these longitudinal records of our lives, meaning if I want to be able to connect those dots, to be able to paint a richer picture of my health, the air that I'm breathing, the activity, the sleep, I need to be able to have this data live in some type of a common platform. There's really big differences in data accuracy. There's really big differences in how companies treat data privacy. There's really big differences in even regulatory rules from country to country. There's a sensitivity to how you design solutions if you want it to be friendly to a medical community. And I think that sensitivity is something that people are starting to recognize in the consumer world, but there's still a pretty big chasm in how you design products. So I think the go-to-market strategy for a lot of these solutions is going to be wide and varied. I don't think there's a one-size-fits-all. I'm a huge believer that for a lot of new technologies, touching, feeling, seeing still really matters. Being able to go to a store and have these things actually working is quite meaningful. And you see like what Target's been playing with in San Francisco. I think a lot of these kind of next generation IoT-centric stores is where retail's going to go. But I don't necessarily think that that's the only path for a lot of these. I think there's going to be a ton that happens online. But I also think that there's a lot of other channels that especially connected health and digital health is going to go through, and it doesn't necessarily have to go direct to consumer.